This video will be an overview of evidence-based interventions. Our learning objectives are to describe what an evidence-based intervention is, identify potential interventions at various levels of the social ecological framework, list aspects of evidence that support the effectiveness of an intervention, describe how we evaluate them, discuss how systematic reviews and meta-analyses can be helpful in identifying effective interventions, and finally identify reputable sources of information about evidence-based interventions. This figure shows the flowchart for evidence-based public health, really a cycle. We start with a community assessment and quantify the issue, and then we develop a concise statement of the issue and try to determine what is known through the scientific literature. And so this is where the focus of our talk today comes in. Next, we would develop and prioritize program and policy options, come up with an action plan, and implement interventions, evaluate that program or policy, and then start over at the beginning and assess the community. So how do we know what is an effective intervention? How do we identify those interventions and figure out how to implement them? Well, an intervention is an initiative, program, or policy designed to affect change. So in other words, it's not just doing screening, for example, to identify the presence of risk factors for conditions, but actually doing some sort of program that's designed to affect change in people. And we can use any level of the social ecological framework as our target, from individuals on up to society. And some examples of those at the individual level might be trying to change healthcare provider practices or trying to change smoking among individuals. At the population level, we could try to increase the number of people who use active forms of transit for work, or the number or the use of recycling and composting within a group. We could try to change social norms around pedestrian and bike safety, for example, or around vaccinations in children. And we could implement specific policies that try to target things like housing discrimination or paid leave for family issues or illnesses. So evidence-based interventions should be research-based, which means that they have a theoretical foundation and have used rigorous study methods to evaluate them. They should have documented benefits. In other words, we should know that they work, and we should know that they influence important and specific outcomes, not just satisfaction with care, for example, but health outcomes. They should have these benefits based on valid measurements. And finally, they should have demonstrated efficacy or effectiveness in specific populations and with valid and reliable results. So a quick terminology note: when we talk about efficacy, we're talking about the impact of an intervention under ideal conditions. So for example, this might be a very select group of patients in a specialty care clinic who receive the intervention from someone like a highly trained physician in a tertiary care hospital, and there might be intensive follow-up by phone and in person to make sure that people are receiving all of the intervention. Whereas effectiveness is a measure of the intervention's impact in a real-world setting. So in this case, we might have a diverse group of patients that are recruited through health departments and outpatient clinics rather than specialty clinics, and the intervention might be delivered by a nurse or an aide or someone who's completed a brief training, and we might do a web-based program instead of in-person with more limited follow-up. So going back to our criteria for evidence-based interventions, we want a theoretical foundation. This is one example of the theory of recent action, but there could be any theory as long as it's a valid one that could underpin the intervention. We want to make sure the study methods were rigorous. So this typically means an experimental study design. Most often we see randomized trials in intervention research. These could be individual or group level. We might also use a natural experiment, and in some cases it would be appropriate to use an observational study, although this isn't very common, and you'd want to make certain that there was adequate control for confounding. Next, we said we want to make sure there are important and specific outcomes that are evaluated in the study. So this means things that are important in relation to clinical care and or the disease process or outcomes. So we'd want to think about short-term versus long-term changes, whether we want to look at blood pressure, weight, or depressive symptoms, for example. And we also want to think about intermediate versus final endpoints, which we've discussed in earlier modules. So this would be cholesterol would be an intermediate outcome on the pathway to cardiovascular disease. So the intermediate ones can be easier to measure because they require less follow-up, and it might actually be more appropriate depending on what our intervention is. We also should consider measuring outcomes that are important to patients. So patient-reported outcomes, the PCORI initiative is one example and has lots of measurement tools available there for researchers. And this would be things like quality of life, pain, function, satisfaction, other patient-important outcomes. And finally, we want to make sure that the outcomes that we're evaluating in an intervention are responsive to the intervention itself. And so this would link back to the theoretical framework. How do we propose that the intervention is going to affect change? In general, when we're talking about measurement, we want to use an existing or validated scale rather than coming up with our own. We could identify these kinds of measures from other trials. A couple examples are here. There's a journal called Contemporary Clinical Trials that describes study design, so that's a nice resource. The peer-reviewed literature more broadly is another good place to find valid and reliable measures. And in some cases, there are websites or other sources that collect measures. One that focuses on rehabilitation outcomes measures is rehabmeasures.org. Next, when we're evaluating the effectiveness of an intervention or the evidence for it, we want to think about the study participants. So who do they represent in terms of their characteristics, their disease status, their general health, and also their healthcare access and quality? Are there reasons that this study population might not represent a broader population and potentially our population of interest? This might be because they're not as sick or they're not as complicated, or there might be different barriers that they experience than our patients that we're interested in implementing this intervention for. We'd want to ensure the results were valid and reliable. So that means having a good sampling strategy, having reasonable success in recruiting patients, having appropriate outcome measures, following the study protocol appropriately, following the analysis plan, so having a plan up front and not deviating from that as a result of the data that were collected, interpreting results correctly, and then exploring null findings. So in some cases, we don't see evidence of an effect for the intervention because of a poor study design. And so we want to be able to distinguish that from a true lack of impact of the intervention. Systematic reviews and meta-analyses can be really useful when trying to find evidence-based interventions. So a systematic review is really just a summary of existing literature that follows a specific set of criteria. So the authors establish inclusion and exclusion criteria based on their research question of interest, find studies that have already been done on the topic, and then summarize them. A meta-analysis is a type of systematic review in which the authors actually combine the results of multiple studies to come up with a new estimate of the effectiveness of the intervention. So commonly we see data from a meta-analysis presented as a forest plot, and that's what is on this slide here. So the forest plot has a vertical line at 0, and then summarizes the results from all of the studies that were included in the meta-analysis. So in this case, the study was looking at vigorous physical activity or interventions that had attempted to increase vigorous physical activity among university and college students. And you can see that many of these studies cluster right around 0, which means that the intervention didn't have any effect, didn't have any different outcome compared to the control group. There were a few studies down towards the bottom, the studies by Grimm, that showed an effect of the intervention. And then the bottom diamond shows the overall meta-analysis result, which also is not very different from 0. You can see the confidence interval there, negative 0.8 to 0.63, crosses 0. So no statistically significant difference in vigorous activity among college students in these various studies. But basically, forest plots give you a nice visual representation of what all the individual study results were and then what the overall summary result is. So these Systematic reviews and meta-analyses are a good starting point when you're learning a new subject area, trying to find interventions that might be effective. It's also a good way that you could identify higher quality studies in the subject area. So usually the authors evaluate the study quality as part of these kinds of reviews. And you might be able to tell whether there are effective strategies for dealing with a health behavior issue. It's important to note that there might be publication bias, and that's the idea that studies that show an effect are more likely to be published than studies that show no effect. It is worth noting that you should also pay attention to the author's approach and criteria when you're using a systematic review to inform your decisions, because they might have defined things differently than you. They might have had a different question in mind than you, and they might evaluate evidence differently than you would. A few good resources to find effective interventions that already have evidence bases behind them are the Community Guide, and this is at thecommunityguide.org. So this is conducted by CDC staff. CDC staffers, along with subject matter experts, do systematic reviews of interventions and publish them. And there are lots of different topics that they focus on. Most of these are community or policy level interventions, so maybe not of interest if you know you want an individual level intervention. They have different criteria that result in 3 basic recommendations levels, so insufficient evidence, recommended, or recommended against. So there are examples on their website about how to use the guide, including one from North Carolina. Other federal agencies also have listings of evidence-based interventions. I think the 2 best are probably SAMHSA's National Registry of Evidence-Based Programs and Practices, SAMHSA's Substance Abuse and Mental Health Services. So all of them focus on some aspect of mental health and substance abuse, but they're quite broad. Very nice reviews on the website, easy to read, and links to the original studies themselves. They've also added in the past year an intervention toolkit, so they have suggestions and other resources if you decide that you do want to implement an evidence-based intervention. The National Cancer Institute also has research-tested intervention programs listed on its website, and those are nice, again, focused on cancer and cancer-related outcomes, but more broad than you might think. You could also search the published literature, so using something like the National Library of Medicine's PubMed, or Google Scholar. Those are both good ways to find evidence-based interventions. In summary, randomized trials are typically used to establish evidence that an intervention works. It's vital to assess multiple aspects of an intervention study to determine whether it's effective and whether it's likely to work in your setting of interest. At a minimum, evidence-based interventions should be research-based, meaning they have a theoretical foundation and have utilized rigorous study methods. They should have documented benefits, and these should be in important and specific outcomes beyond satisfaction alone, and they should have used valid measurements. Finally, they should have demonstrated efficacy or effectiveness within specific populations, and again, have valid and reliable results.